In this video, we're looking at what if a child goes unresponsive and what happens if a child goes unresponsive and stops breathing. When I'm talking about a child in this case, the age is from the age of 1 to 18. It used to be to puberty, but down to research about a year ago, they've now extended it from 1 to 18. We're going to look at this situation the same as exactly what we would if it was an adult. And we want to do the primary survey. The primary survey will guide you through on what to do at each stage. You have a child. Maybe you walk in and you see them collapsed on the floor. Or maybe they get knocked over by a car or fall from a height. Dr. ABC. D stands for danger. It's absolutely essential that you make sure that it's safe for you to go and aid that child. If it was in the middle of a busy road, of course you have to get the traffic stopped. But it's actually safe just now and I am able to help. Now R stands for response. We want to find out if they're sleeping. Maybe they are, maybe they're not. To do this, we want to shake the shoulders and we want to shout in each ear. If you know the name of the person, then you can say it. I'm Sarah. George, can you hear me? Can you open up your eyes? Can you hear me? Try and open up your eyes for me. Once I've checked to see if there was a response, there wasn't any. It is now classified that this child is unresponsive. This is serious. In a real life situation, you naturally would probably shout for help. If somebody came to aid you, then that's great. But if you're by yourself, you need to carry on. We have to go on to the A, B, C. Just like with an adult, with the A, we have to open the airway. Now I want you to put your head all the way back, as far as you can, as if you're trying to look over the back of your head. Now try and swallow. You either can't or it's very difficult. Why? When somebody is unresponsive, every single muscle in their body relaxes. It's what we call dead weight. Now your tongue is a very strong muscle that will also relax and it will block the airway. So what we have to do is open it. And to do that, we have to hold the head. Put your hand on the forehead of the child. Put one finger underneath their chin. And we're going to do a head tilt chin lift. Lifting the tongue off the back of the airway. Now you have to keep this open. If you let go of the head, it will close. So opening the airway, we now need to do B. B is for breathing. So you want to get your head down and you want to look down the stomach. Can you see it rising, falling? Can you hear? Can you feel them breathing? And you have to do that for 10 full seconds. 7, 8, 9, 10. If the child is breathing, that's great, but it's still serious because they're unresponsive and breathing. If there is somebody with you, get them to go and call emergency services and ask for an ambulance. When they get put through to the ambulance services, the first question they're going to ask is the casualty breathing? And the answer is yes. I have to put this child now into the recovery position or onto their side to make them safe. Because they're a lot smaller, they're a lot lighter. Quite simply, all you want to do is pull them onto their side, like so. When the child is onto their side, it's essential that you open up the airway by tilting the head back. Now that you've got the child safe, we want to look at the C. Now C stands for circulation. Circulation is what is happening in our body. When your heart beats, It pumps blood around the body, which carries oxygen. This is the circulation system. What I'm looking for here is if there's been any break in the circulation, as in blood loss. If I saw any blood coming out of the child, you're going to grab whatever you can and hold it directly onto them to stop the blood from coming out. Now that they're safe, you're going to stay with the child. The most important thing that you must keep monitoring is that they're breathing. I'm putting my hand in front of his face and keep reassuring them. It's okay. You're going to be okay. There's an ambulance on the way. You're going to be absolutely fine. And keep talking to them. Now, that's what we're going to do if a child goes unresponsive, but they're breathing. But let's look at the scenario now. What if the child goes unresponsive, but they're not breathing? Now, this is very rare. I do want to stress that. I don't want you all to panic. But knowing what to do should it happen is priceless. So I'm going to go through that Dr. ABC one more time. So we know that D is for danger. Make sure it is safe to approach. R is for response. Again, you're going to shake the shoulders. If you know their name, say it. George, can you hear me? Can you open up your eyes? Open up your eyes for me. They can't. They are unresponsive. Again, natural thing is to shout for help. That's great if somebody comes and helps you. They will be able to go and call emergency services once we have some more information. But if you are by yourself, you're going to have to do it all. Let's do the ABCs. So we know that A stands for airway. We know that why we're doing it is because we have to lift the tongue off the back of the airway. Keep hold of it. B, you know that B stands for breathing. We're going to look down the tummy. Can we see it rise and fall? Can we hear? Can we feel them breathing on our face for 10 seconds? The child is not breathing. Now, this is something that is different from an adult. When an adult goes unresponsive and stops breathing, it's more than likely a problem with the heart. Adults, like me, we've got a lot of miles on the clock. It could be drinking, it could be smoking, it could be drugs, late nights, partying. More than likely going to be a problem with the heart. But when we're looking at this age group between 1 and 18, it's more than likely going to be a problem with their pulmonary system, their breathing system. Why? Because they're so young, they don't have a lot of miles on the clock. If you imagine you buy a brand new car, brand new, and you're driving it out of the showroom, what do you think the chances are of the engine breaking down? The answer is slim. Our heart is our engine. So they're pretty new. More than likely going to be a problem with the breathing. So with this in mind, with a child, we have to start with 5 initial breaths. The reason why this is so important is that these breaths could get the child breathing again, and you may never have to do any compressions. So to get those 5 breaths into the child, it's the same as an adult. You have to tilt the head back to lift the tongue off the back of the airway, and you have to pinch their nose so the oxygen doesn't escape. You've got to get your mouth, a good seal, onto their mouth, and 5 rescue breaths, turning your head away in between each one. 1, 2, 3, 4, 5. If the child is still not breathing after those 5 rescue breaths, we have to start pushing the blood, which carries oxygen, around the body. Now, depending on the size of the child will depend on whether you want to use 1 hand or 2. If you've got a 12-year-old that's really quite strong and has a large torso, you're probably going to be using 2 hands. It doesn't matter, whatever is comfortable for you. I'm going to show you both. So using one hand, I'm going to use the heel of my hand and I'm going to place it directly in the center of their nipple line because this is where the heart is. It's essential that you have a straight arm, no bending, shoulder over your wrist. And we're going to give 30 compressions now. The speed of these compressions are the same as if it was an adult, between 100 and 120, about 2 a second. The depth of the compressions, when it comes to a child, is roughly about a third of the depth of their body. It is with effort. Here's a demonstration. "25, 26, 27, 28, 29, 30. After I've done 30 compressions, I want to get more oxygen into the child. This time I'm only going to be doing 2 rescue breaths, the same as if it was an adult. To get the air in, again, we need to tilt the head, we need to lift the chin, and we have to close the air with the nose. 2 breaths, good seal. 1, 2. If it's too hard for you to get the depth using one hand, or the child's a little bit bigger, or maybe you don't have a lot of strength yourself, it's okay. Use 2 hands. One hand in front of you, place the other hand on top, and you want to squeeze that bottom hand, keeping these fingers out. Again, we're going to use the heel of the hand, and it's also going to go the same place as last time, right in the center of the nipple line. Straight arms, shoulders over your wrists. 30 compressions. 25, 26, 27, 28, 29, 30. After you've done the 30 compressions, you would then naturally give the 2 rescue breaths. And you will continue doing this until one of the 3 things happen. Number 1, if the child starts to breathe, you're going to see that they're breathing because you will see the muscles contract. If you see that happen, stop. Just make sure that the child is breathing by doing your A, open up that airway, get your head down, check to see that they're breathing, check for those 10 seconds. Can you see the chest rising and falling? Can you hear? Can you feel? If the answer is yes and they're breathing, you then put them into the recovery, get them onto their side and make them safe, making sure that you tilt the head back, the airways open, and keep monitoring them until emergency services arrive. The other time that you would stop, of course, if you were physically unable to continue, that's just a natural thing. If you can't do something, you can't. But here's the good news. In a situation like this, you are going to have adrenaline going around your body. You will be surprised by what you can do. And the other time that you're definitely going to stop is when the paramedics or first responders arrive and ask you to stop, and they will take over. Bear in mind though, it'll take them a little while to get all their equipment in and ready to take over. This is extremely rare to happen, but you never know. It's good to have the knowledge and never need it, than need it and you don't have it. I'm Sarah, owner and trainer of Mini First Aid Aberdeen and Aberdeenshire, making training fun, engaging, but most importantly, memorable.